home of hope. 103.5 FM, WMUZ, The Light.
Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, hello, Metro Detroit. This is Dr. Joseph Kanu of Rochester Chiropractic.
And my name is Jeff Haddad, Dr. Jeff Haddad from Rochester Advanced Dentistry.
Yes.
And I'm here again and looking forward to another good show.
We are here again to educate and entertain.
You got it. That's our new slogan. I'm telling you, we need to get...
You have some slogans, Jeff, but nothing is better than safer, stronger, last longer.
Yeah.
That was a great one.
We're going to have T-shirts made for you.
Well, anyways, this show, we're going to cover dental implants.
Yes.
Okay,
we've mentioned it several times in the last, month or month and a half,
yes.
And they keep coming up as, unfortunately, if you lose a tooth, we want to avoid that if possible, but if you were to lose a tooth or several teeth, or have already lost all your teeth and have a denture, dental implants it's one of the more amazing things that dentistry has to offer.
That add a lot of health.
Oh, to
your life.
It brings you right back to proper function. I mean, it's literally replacing what God gave you, intended for you to have. Unfortunately, things may have happened where you've lost some teeth, and the best option that we have to offer you is a dental implant. It's literally a artificial root that replaces your tooth. They're 97% success rate, prognosis. And what I really want to cover tonight is really what it comes down to is patients who maybe don't even believe they're candidates for it because they've been told that. Things have changed so drastically, Joe, even in the last few years, that allow people that have been told that there is no way they could have dental implants, and now they can.
Well, that's exciting. So 2 years ago, they couldn't.
That's correct.
And now, because I know you just went to a seminar, and I'm really impressed, truly, Jeff, at how much extra training you do. I don't know any dentist who does as much as you do, and I know some fine dentists who do a lot. But and so I want to hear about this seminar. Why don't we?
Well, it's going to go perfect with our topic tonight because it really talks about the newest technologies and really what allow us to make these patients candidates or good candidates for dental implants. So, we'll definitely get to that.
Well, great. Well, let's start with our scripture reading. Okay? Let's see. Let's go to Titus. We haven't read out of Titus in a while. Okay, chapter 2, verse 11. Beloved, the grace of God has appeared, saving all and training us to reject godless ways and worldly desires and to live temperately, justly, and devoutly in this age as we wait for the blessing and hope, the appearance of our great God and Savior, Jesus Christ, who gave himself for us to deliver us all and to cleanse his people and his own who are eager to do what is good. And amen to that. And that's what we need to do is keep clean our lives and the temple of the Lord, the body, and certainly, Jeff, you're helping us understand the mouth and the importance of teeth and how that really affects. It's not just cosmetics. It's, as we've always kind of thought, that Hollywood smile or whatever. But this is for bedrock health. And, I mean, I love that you've covered sleep apnea and TMJ issues. And we've covered how to prevent, flossing and cavities But if you do
we want to promote flossing, not prevent it.
Promote it. Thank you.
Prevent cavities by flossing.
Prevent cavities by flossing.
Right.
Thanks.
Yep.
And but moving forward, though, if you have lost them, the patients that I have who have if you have dentures, please, you need to listen to what Jeff's going to say tonight, because that is not the way to go.
No, it's not.
So
a lot of people, human beings are amazingly versatile. I mean, they can accommodate to anything. Now, I've yet to meet a denture patient that loves their dentures, but they're getting by. They're living life. They're eating what they can eat. I mean, you can.
Sometimes it's almost like, do you not know any better now?
Of course.
Or do you think, have you settled for this is what it is? It is what it is.
Right.
Is there a better solution?
Yeah, and a lot of people, unfortunately, don't know that there are these options, to a point where if you have dentures right now, a lot of times we can actually place dental implants and utilize your own dentures, where you don't even have to get a new set of dentures, because a lot of people look at that as extra costs and extra quote-unquote hassle, all that. Well, again, depending on the condition of your denture and depending on the situation, we can secure your denture. And for those of you who are either have dentures or even those who don't, what we're talking about are really people who don't have any anchorage in their mouth, okay? You've got a denture that's literally floating around. Now, if it's an upper denture, well, there's a suction principle that kind of keeps it up there. It doesn't keep it up there amazing, and it's not a replacement for teeth. Why don't we start there? For those of you who almost have kind of given up on their mouth, maybe they still have teeth, but they know, someday I'm going to have a denture, and you actually think that's going to be a good thing, please ask one of your fellow friends or family members who do have dentures, because I'm going to tell you, I had a mother or a daughter and father in a consultation last week, and this was very interesting. She has severe TMJ problems, a very destructive bite, and because of that, she's losing teeth. Literally,
the daughter
is. She's
wow.
She's low 40s. Okay?
Okay.
Her father is low 70s. And she was making a joke saying, well, I'm probably just going to get dentures. You have them, Dad. You're doing fine. He must have stopped her 3 times to say, you do not want this. I don't want this for you. I mean, he was not living his quality of life. Now, I didn't just met this man.
This is as a 70-year-old telling his 40-year-old daughter,
which was,
you don't want this.
You don't want this. I mean, there's no denture that's ever going to tell you that, this is as good as my old teeth were. No way. The best denture in the world is half as good as the worst tooth in your mouth. Okay? So please don't think it's going to be easier to live or to take care of things because you can take your teeth out. It is a very poor
so what
substitute.
if I get cavities and lose teeth, I'll just get dentures.
You got it. It's just nothing.
Not a good answer.
You wouldn't wish it upon your worst enemy. Okay? So let's start off there. Now, back to the people who do have dentures. Again, to have some anchorage, even if it was 2 implants. The preference for a lot of people really is 4 implants on the lower and 4 to 6 on the upper.
You need that many.
Well, you don't. As I was going to say, we're talking ideal.
Ideal. But ideal is 4.
Correct. But if you
is it the 2 backs?
It's actually more of a more in like the 4 corners of your mouth. You want to have stability. Now that said, if cost was a factor, which it can be for a lot of people, and I appreciate that. If you were to have 2 dental implants on the lower, where your eye teeth are, essentially on the lower, it will be night and day better than what you have right now. Okay, I think we've talked about my one patient, my cousin, who we did place 4 implants on her lower. She was living with a denture for a decade. She called me that night, the night of the surgery. Okay, we gave her dental implants instantly. That night she called me and said, I just had the first hamburger I've had in 10 years. The day of the surgery, Joe.
Wow.
You think about that.
The day, and plus a hamburger is not like flank steak.
No.
Or something.
No. You got to work.
She couldn't eat a hamburger with her dentures?
Because of that biting thing. You bite on that, and you've got something that's not anchored. What's going to do? It's just going to flop. And when they start flopping, it starts hurting. It becomes very cumbersome.
Right.
So it's people just don't realize. Again, for those denture wearers who are listening right now, I know they're kind of nodding their head because they understand.
They get it.
For the people who don't, please listen to my words, and again, ask somebody else, because this is nothing that you want for yourself. And again, I guess the one point I would like to make too, a lot of people are afraid of the idea of dental implants because it is surgical in many, many ways. But we just talked about my cousin. That night, we placed 4 implants. That night, she's eating the first hamburger. I mean, things have changed drastically, Joe. This isn't I would say probably 75% of the time, we don't even have to use a scalpel. Okay? We can literally place these implants right through the gums without even making any incisions or sutures.
Wow.
I mean, that's pretty appealing to people.
That's very appealing.
And we're not talking narcotics afterwards either. The majority of my patients take some Motrin that day. This is less involved than a root canal a lot of times. It's less involved than the actual taking out of the tooth. It is the process has been simplified.
How can that be?
Well, the class that I just returned from.
Yeah.
Okay. Couple things that they really concentrate on. 3D scans, which we've talked about. We have one in our office.
You have.
This is a 3D digital rendering of your exact skull. And we're not talking any distortion. We're not talking guesstimation. It's exact. For us to have that data at our fingertips, we know exactly where and how to place these implants in anybody. And there are patients out there, like we talked about earlier, that have already been told you are not a candidate. If it's been a long time and if somebody's told you that, please, I'd be happy to take a look at you. You can go on our website to learn a little bit more about this, RochesterAdvancedDentistry.com, or please call for a consultation, 248-656-2020, because unfortunately you've been misinformed, or at the time that they told you this, that technology wasn't available. So to answer your question, well, how is that possible? 3D cone beam scan, that's the first thing. The second thing are the new procedures for bone grafting. Okay, for those of you who have listened to some of our past shows, and Dr. Joe knows, if you lose a tooth, there's many things that follow. We have tipping of the teeth into the space. We have the above tooth that was opposing the tooth that will grow into the space too. It's a huge domino effect. But most importantly, or maybe as importantly, the bone that tooth used to be in, that will very quickly start to disintegrate. The only reason that your jawbone is there is because you have teeth. It's the stimulation of the teeth and the function and the mastication that keeps that bone strong and keeps that volume there. Once the tooth is gone, on average, within the next 3 years, you will lose 60% of the volume in that area.
Yeah, that's a lot.
Drastic. Okay, your bone is literally deteriorating and disintegrating. Now, you place a dental implant in there, body treats it like your tooth. Bone stays, function's happening, and we have replaced your tooth with the next best thing to your natural tooth. Okay.
Wow.
And
so the body does recognize it as a tooth.
Yep.
It's getting, the jawbone is getting stimulated.
Correct. We use titanium, which is used by pretty much every orthopedic surgeon out there because the body welcomes it. Accepts it. And so it integrates into the threads of this titanium root. And the process, which let's get back to that for those of you who are not familiar with the process. Let's say you have a tooth that needs to be extracted, unfortunately. My absolute everyday procedure for this is we don't just take a tooth and let you go. We need to prepare that area for success and prepare that bone for success. So when we extract the tooth, we're going to clean out any infection, any bacteria, and then we're going to place a grafting, mineralized bone, cadaver bone, okay, that is completely safe. There's kind of a joke in our office of, well, what kind of bone are you going to put in there? I'm like, well, you have 3 choices. You have human bone, pig bone, or cow bone. Which one do you want? It's really you can use all 3, okay? But I would prefer human, okay? So we use that, we place it in there, and about 3 to 4 months later, we're ready to place our implant, okay? We place our implant in the bone, and it's allowed to heal. We can't just build a tooth on it that day. It's got to integrate. The body's got to heal around it, and that is about a 4-month process. Once that's healed, 2 weeks later, we will have a crown for you, and you're done. So if you're missing a tooth, it's about a 9-month process. If you're already missing the tooth, well, we don't have to wait. We can place our implant in. We still have that waiting period of the 4 months of healing, but you have 4 months start to finish. You've got that tooth replaced. For denture wearers, it gets even better. There are times, depending on the person, like with my cousin, that you could place 4 implants, and you're using them that night. And again,
that's amazing.
It's just the mechanics of it and the way that it works. So there's no waiting period at all. I mean, you have instant teeth. And we've mentioned this stat. It's been a long time, but when you have all your teeth, the majority of teeth, you're functioning at 100%. Denture wearers are functioning at 10%. 10%.
Yeah.
We give them dental implants with those with their dentures. They're right back up to 90%. I mean, it's night and day with those with their dentures. They're right back up to 90%. I mean, it's night and day. I mean, it gives you your life back.
Which is so important. We talk about, digestion begins in the mouth. Right. The importance of chewing and breaking down your food good first in the mouth.
Right. I mean,
and if you're not.
It's the absolute key to the beginning of all health,
So Jeff, do you have to go to an oral surgeon to have these implants? I mean, what is the procedure?
That's a really good question.
Because that's what I always say. This was oral surgery,
right?
A major deal.
Well, back in the day, it was okay, and to some degree, it can be. I mean, the class that I just returned from, we were doing. People who have very low sinuses go right into where the upper teeth, fit in.
So those people were definitely told you're not a candidate.
That's correct. Right? But now with procedures, we can actually move that sinus above, move things out of the way, replace the bone in that area, and make them candidates. And to answer your question, this was something that only oral surgeons did back in the day. But that was because we're dealing with scalpels and a lot of more antiquated procedures.
Equipment.
I mean, I will be doing that exact procedure in 2 months. Okay, we have a patient that's doing this. So to answer your question, oral surgeons are great at what they do, and we deal with them a lot. There are a lot of patients that I don't feel comfortable working on because of maybe their health issues, health concerns, or somebody who wants to be, say, put out. Let's say somebody's very nervous about things. Well, then I'm going to refer them to my local oral surgeon, they're great, and they're going to give them IV and they're going to put them out. We don't do that in our office. But you don't need that majority of the time. I mean, a local anesthetic, you're going to be completely comfortable unless you're just a real fearful patient. But even those patients, we can give them oral sedation. We've talked about nitrous oxide. I mean, these are all
nitrous.
All great things that we can use. But there are dentists. Let me answer your question. Sorry to go off on a tangent, but there are many dentists who aren't comfortable placing the dental implant. Okay, and if that's the case, it depends on your dentist. So for those of you listening, you'll have to ask your dentist, do they place dental implants? And it's either a yes or no. And if they don't, they're going to have their oral surgeon place the implant, and then most likely they'll restore the tooth by putting the crown on it when it's ready. I just believed, and my partner and I mean, we've been placing implants in our office for 20 years. It's just made more sense for us because I've got to restore the mouth. I've got to know the end game. So I want to know where the root should be so that I can finish the job properly. And that is a nice advantage because when your dentist is kind of controlling the whole situation, there's no guesswork. There's no miscommunication. Now, again, I have many dental friends who don't feel comfortable doing that, and they work great with oral surgeons, and the communication's there, and it's perfect. So, yes, they can be placed by oral surgeons, but they don't have to be. Okay, I mean, the process has been changed and improved so much that it's less of a surgery than it ever was.
Well, Jeff, when you went to your seminar, like you said, and 2 years ago, people who were not a candidate for implants and were stuck wearing dentures.
Right.
Now they are. What has changed besides? Did I miss something here? I mean, I know you have your cone beam.
So the 3D allows us to know where the bone is. Exactly.
And this machine that you have, not many people. I mean, you
No.
said U of M has it.
Yeah, there's not many people in the area that have it. You know, it's something that we invested in. It was a big investment, but it's something that, in my opinion, should be the standard of care. Because would you want me going into a surgery on you blind? You don't. I don't like surprises.
No, you want to
know. We literally
Right.
do these surgeries, Joe, digitally before the patient even comes in. We place the implant digitally and move it and do all this stuff. And then we have guides made from that computer scan that will guide my instrument and everything right where. So it's planned. It's perfect. It's the success rate is so high because of the predictability. Now, back in the day, can you just go in there and open up things and just see what you got and then deal with it? Well, of course. And there are a lot of people who still do that. If I'm the patient, that's not the way I would want to be worked on. Okay, so that's the first thing. We have data, we have technology for us to see before we even get in. And then the second thing are these grafting procedures that we're talking about.
Okay.
If the bone isn't there, then back in the day, like that, you don't have the bone, we can't do it.
You don't have the bone. So now that's where the cadaver bone comes in.
You got it.
The grafting bone.
So
it takes time, but you can build it up.
You got it. Now
that's where it will take the 4 months.
Correct.
Because if the tooth's been missing long enough time where there's bone demineralization, the bone is wasted away. You now have a way to build that up.
That's correct. And each person's different. You know, it's not just here's a bone graft for everybody. It's not. There's different types of bone grafts. There's different types of approaches depending on the situation. Now, how do people know what that situation is and what they would need? Right back to my 3D cone beam, okay? That if somebody comes to our office and is inquiring about implants, the first thing we do is we get that scan. That gives me all the information that I need. We can do measurements on it. We can do anything we want. I mean, we literally are taking the skull, and I've showed you this before, and I know you were wowed by it. We literally have a exact representation of your entire skull that I can maneuver in any which way I want, any view I want. And again, we can place the implants. We can see how much room's there. If bone is necessary, what we would need to do to achieve our goal. And again, it's just technology. You know, I mean, the techniques and technology that's happened in the last few years it's exponential. It reminds me of just the computers in general. Computers kind of did this big takeoff, right? And it's just you know, you buy a laptop, next year it's obsolete almost.
Sure.
It's amazing, and that's really how much implant dentistry has changed in the profession.
Hey, Jeff, so when you have the implant, how long does that last for?
Well, I'll tell you, there's not many things that I say in dentistry that last forever, because there just isn't. And people ask us all the time, Doc, is this filling going to last forever? I'm like, well, what do you know in life that lasts forever? You're like, that car that you bought, is that going to last forever? No, and they laugh. I'm like, well, I'm putting a little filling in the most destructive environment you can think of, which is your mouth. It's not going to last forever. It's going to last a long time. Now, dental implants, we said the success rate's 97%, okay? And that is after a 10 to 20 year time period.
Wow.
Okay. Let me put it to you this way. Once an implant is integrated, very, very, very rarely is it going to fail. Okay, the crown above it would be the weakest link, and you know how hard our crowns are now, right?
Right.
But if you were to break a crown, the crown would have to be replaced, but not the implant. So how long they last? I mean, you could say a lifetime.
Pretty much lifetime.
They could be a lifetime. I mean, don't get me wrong, anything can fail, but there's nothing else that I could say in dentistry that lasts as long or is as predictable as a dental implant.
Wow.
I mean,
that's kind of cool.
Well, the reason is this.
You say that. So nothing lasts as long as
nothing. Because here's the biggest factor.
Yeah.
What did we talk about a couple shows ago? What were the big things? Cavities, right?
Yes.
Can't get a cavity on a dental implant.
Right.
Okay. Titanium does not. There's no cavities on titanium.
Yeah.
So that's the biggest factor. You know, if you had a bridge, for instance, you know, the other option when you replace a tooth is.
Yes. Go ahead.
Yeah. Somebody's doing some testing here.
Yeah.
We have the other option is a bridge. Okay, a bridge is when you are missing a tooth in the middle, and we have the space, and on each side of the space you have 2 teeth. We put crowns on those teeth, and then there's actually a crown, a fake tooth that's sitting right on the gum tissue in between, hence the bridge. So you got 3 crowns that are connected to each other. And it's a very good option. I mean, we've been doing that in dentistry for, 50 plus years.
Yes.
But the weakest link there, decay. You've got 2 teeth that have the susceptibility of decay. So after, we talked about success rate, 97%. After 10 years of a bridge, the success rate is only 50%. And again, it's because there's other factors there that are susceptible to leakage and bacteria and decay. The implant doesn't. Okay, so I can't say enough about what it does for people's lives. It's a quality of life thing. It changes people's lives. My cousin's a perfect example of it. And if you are a person who's having any type of problems with, their dentures, or if you have lost a tooth. We've said this analogy before. You lose 1 tooth, it's like taking a book off a bookshelf. Both books cave in, which are your teeth. Tooth above can grow in. You are starting a domino effect that is going to take you down a path that you don't want to go. Yes. So replace it. It's very important. Teeth are always in motion, and if you unfortunately lose a tooth, this is the best option for you.
Well, great. Thanks, Jeff. So if you have lost a tooth, get an implant right away before there's a lot of bone loss. If you've been told you're not a candidate, there's new procedures out now. If you do have dentures, you're only at 10% chewing capacity and health capacity. Please get these implants and anchor them. It's going to add a lot to your life. And if you do have your teeth, take care of them.
Yes, sir.
And remember, you can watch all these shows on, listen to them on simpletruthsforhealthyliving.com. All of Dr. Jeff's info is there. And remember, in all that you do, eat or drink, do all things to the glory of God. We'll see you next time.
Looking forward to it.
Yeah. Do all things to the glory of God. We'll see you next time.
Looking forward to it.
Yeah.
Do you suffer from headaches, migraines, or jaw pain? Have you been diagnosed with TMJ problems? Dr. Doolin and Dr. Haddad at Rochester Advanced Dentistry have helped alleviate these symptoms successfully for hundreds of people just like you. Dr. Doolin and Dr. Haddad have advanced training in the latest techniques in headache and TMJ treatment. Their success and conservative approach in treating pain patients for over 10 years has prompted referrals from many physicians in the area. Don't suffer any longer. For more information, visit RochesterAdvancedDentistry.com or call Rochester Advanced Dentistry at 248-656-2020. That's 248-656-2020. You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.